So we're kind of nearing the last stage of the program, but I wanted to see if we could give an overview on the scary stuff like skin cancers, which I think are fairly common. Uh, could we do an overview on the more common types of skin cancers in general in terms of what causes them, how to look out for them, and a high view on what the current treatments are?
Sure, I'll be happy to kind of answer those questions. So in India versus the US, the types of skin cancers and the incidence and the prevalence are very different. Having said that, in the US, the most common type is a basal cell carcinoma, from which there's various subtypes. In the US, we see around 5 to 6 million cases per year of skin cancer. Number one is basal, second is squamous cell. However, in terms of mortality, the melanoma category is the highest. You have different subtypes within that as well. The South Asian population, because of the fact that the lifestyle is a little bit different, people are not trying to get tan. People are not, out in the sun without trying to wear something like a hat or something, allows them to have a lower incidence of it. But there are certain subtypes that can be more common. If you see a spot, in speaking broadly, on your body that is new, that perhaps is changing size, shape, or color, then it might be worth to take a look at. The majority of them tend to be benign, like a seborrheic keratosis or something like that. But if you see a spot that is bleeding or is changing rapidly, then that may indicate it's active. Now, if there's certain types of cancers that are more genetically induced versus sun-induced, from the sun you get point mutations in the DNA that over time become uncontrolled and therefore cancer with their growth. Whereas if it's genetics, it's kind of a different kind of pathway entirely. But in the US, at least, the most common is the basal cell carcinoma, from which you have your various subtypes from nodular, superficial, infiltrative, and so forth, and pigmented. And then you have your squamous cells, and then other types as well. There's some types of skin cancers like angiosarcoma, which are found in all population groups that are actually very deadly, mostly found in sun-exposed sites of the head and neck. And the treatment options for cancer normally, if it's something that's not advanced, is to excise and get clear margins. If there is spread, for example, squamous cell carcinomas have a high risk of spread than basal cell carcinomas because they tend to travel via perivascular and perineural routes. Then we loop in our